You do raise an
There we
interesting
go.
point. You do raise an interesting point about communication in general, though, and I think this is something that I'm keen to chat about. Um, Consulting styles. Now, I've seen probably two main consulting styles. There is a third one that I'm aware of, which I've never seen. I think this is a unicorn. I don't think it exists, but it is something that I always say, like whenever we have students who see practice with us, I'll mention it. Because I think the communication skills, they've been identified as a weakness for recent grads, and it's something that I'm like, you'll always continue to get better and better and figure out like what hits with some owners, what hits with others, and how to quickly realize if you're losing your grasp on the pull of the conversation. But I suppose the historical role of the vet was that of a guardian, and this is where basically the vet presents all of the information, but they'll only really present their preferred option to the client. And this may be something that I suppose I think that older vets is something that that's how they would have been trained to consult. And as well as that, it's probably relevant, or it's probably the proper and right thing to do in an emergent type patient, in that kind of situation where you don't really have time. The second one, and this is what I think I am slipping into, which is good and bad, but this is a kind of collaborator type role. And this is where you try and provide all the information, you try and educate the client, you tell them all the different options, or maybe you try and there might be 5 options, but you narrow it down to maybe 3. So a kind of modified type approach. And it's a shared decision making between the vet and the client.
Yes, known as a client concordance, isn't it? It's a concordant style of consulting where a mutually advantageous contract is sought.
This is exactly it. And I think that in human healthcare, they realize that this results in kind of better health and patient outcomes. So like the feeling from the patient is better, or so I'm assuming that it's the same in veterinary as well. And also it kind of helps you when you're going through that shared decision making. If there are any potential obstacles like financial barriers, you can potentially overcome those, or it might become very clear that option 3 is just off the table for now. The unicorn option I've never seen, and I'd love if you guys have seen it. And this is a teacher role where you pool the information from different sources, the veterinarian, the client, elsewhere. You present all the options to the client with no weight given to your preference as the vet. And then that means that the client is the primary decision maker. Now, I have never seen that myself. I don't know if you guys have seen that.
No, again, I've heard of it, but I don't see how it would work.
I think if I was a client in that position, I think I'd be saying, okay, right, I've got the information. So how much are you going to pay me for the decision?
Fair enough.